Well, hey guys, I made the mistake the other day of going on TikTok, so that means I lost like 3 hours of my life. Everyone's favorite it girl over there, ALIX EARLE, came up on my For You page talking about her nose. Many people have speculated that she has had a nose job, but she goes on to say,
I genuinely think that I got a nose job in my sleep. Look at my nose. Like, granted, I didn't know how to use nose contour at the time, but it's crazy how much your nose grows into your face. I've literally had boyfriends before and I've shown them young photos of me, like going through puberty. And they're like, I literally don't believe you. They asked my parents, like, did she have a nose job?
But she goes on to say, I genuinely think I had a nose job in my sleep. Your nose is not going to change overnight, but it does change. So I thought in today's video, it would be appropriate to talk about how your nose changes, not only with age, but with underlying circumstances, life events, if you will. During childhood, adolescence, and early adulthood, your nose is growing. The bones, the cartilage, they're growing. In the teen years, your nose can change quite a bit. So she's comparing photos to when she was like a teenager, so it doesn't surprise me that her nose looks different. Doesn't necessarily mean though that she had a rhinoplasty. Generally speaking, your nose finishes developing by the age of 18. While your nose is kind of fully formed and grown by the time you are, well, grown, early adulthood, it will continue to change as you age. Part of how your nose changes in appearance has to do with your skin. The skin overlying your nose with age, it thins. You lose collagen, you lose elasticity. Elasticity is what gives the skin snap and recoil, and all of those changes affect the appearance of your nose. The cartilage in your nose also will thin and weaken with age, so that combined with the changes in your skin lead to a nasal droop. So the nose actually droops a bit, and that creates the illusion that your nose is getting longer. The nasal cartilage can sometimes become brittle, become thin, just like your bones with age. As you get into your older adult years, it's actually not uncommon for your nostrils to enlarge. The little pieces of cartilage that attach the tops and bottoms of the sides of the nose, they actually can separate a bit, so that can impact the way that your nose appears. All of these things lead to lengthening of the nose, but that's really just an illusion. It's not actually that your nose is growing in length. It's just the structures are changing, so it appears longer and sometimes more bulbous or larger. The other thing that can happen to your nose with age is that all of a sudden you wake up one morning and you're like, wait a minute, I have a bump on my nose. What the heck? That bump was in fact there all along, but it wasn't as obvious. You see, as the skin thins overlying the dorsum, the back of the nose, as that skin thins, the stuff underlying it is going to be more obvious, including that bump. That's not an uncommon change, actually. And then, of course, with age, the deep fat pockets underlying our skin, they change a lot, and that ultimately can really change the appearance of your face quite a bit, including your nose. Then you have the sebaceous oil glands. We talk a lot about these in my videos on acne, on oily skin, but your nose has a ton of sebaceous oil glands. They can enlarge as you get older, and that can make the nose appear larger. That combined with it appearing longer overall really can change the shape of not only your nose, but just change the way that your face looks in general. And for a lot of people, it's unsettling. They don't like that, and they seek out aesthetic procedures to correct those things. When you think of cosmetic procedures for the nose, probably what comes to mind is rhinoplasty, surgery. But there are a lot of minimally invasive procedures that can rejuvenate the appearance of the nose, improve the nasal tip. A lot of people develop prominent blood vessels with age overlying the nose as well, and that too is something that bothers people cosmetically. Skincare products are not going to get rid of these prominent blood vessels. Are called telangiectasias. See a board-certified dermatologist. Vascular lasers like pulse dye laser, KTP, can target those bad boys, cause them to shrink, involute, and go away. If you take out your old high school yearbooks and compare what you look like now as an adult in your 30s, 40s, and 50s, you compare your face, you're gonna notice that the nose looks at least subtly different. So those are more slow, gradual things that you start to notice with advancing age. But if you're in your early 20s and you look at a photograph of yourself, say, I don't know, the last year of middle school, junior high, maybe your freshman year of high school, it's not surprising that your nose might look different. Because again, your nose continues to grow throughout your teens and into early 20s for some people. But she also points out that she contours her nose with makeup, so don't underestimate what makeup can do. It can really change the way your face looks quite a bit just by contouring, shadowing. The other thing that can change the appearance of one's nose is if you have had injectables to your face, like your cheeks, for example. not actively changing the size, the dimensions of the nose. Again, it's an illusion though. Your nose is still the same size, the same shape. Filler has not altered your nose anatomy in any way, but it's really just distorted things and changed everyone's perception of how your nose looks now. Now I want to talk about some circumstances that might impact how your nose looks outside of just age-related change or the changes that happen with late adolescence. Rosacea. Rosacea is a chronic inflammatory skin condition. If you have it, comment in the comments section. You know, rosacea is characterized by bouts of flushing, facial redness, as well as the symptoms of sensitivity, burning, stinging, discomfort. People who have rosacea, they often will go on to develop persistent dilated blood vessels, telangiectasias, including over the nose. If rosacea goes untreated, one complication that can happen, especially for men, more so than women, but it can happen to women for sure, is something called phymatous change. It can really happen on the nose, in which case it's called rhinophyma, though it can happen on other areas of the face as well. And this is characterized by thickening of the overlying skin, enlargement of the sebaceous glands, and that really can distort the appearance of the nose quite a bit. It's a gradual change, the nose starting to become more swollen over time, and then the texture over the nose becomes more irregular. It really can bother people cosmetically, and the way that is treated is actually with resurfacing lasers. There are a lot of underlying medical conditions that can impact the nose, lead to something called a saddle nose deformity. Hansen's disease is an infectious disease that can impact the nose and cause saddle nose deformity. Relatively uncommon, but it's becoming increasingly common here in the US. There are pockets of the US where there are a lot of cases of this, like in Florida. Here in Texas, we see a lot of Hansen's disease. Then there is a condition called trigeminal trophic disease or syndrome. Basically, it's a type of nerve damage that causes persistent discomfort and pain and itch on the nose. This discomfort can cause people to touch their nose, pick at their nose, and the nose itself to break down and change in appearance. Pregnancy will change the appearance of your nose temporarily because there are a lot of changes that happen in your body when you are pregnant that make their way to impact how your nose looks. First of all, when you are pregnant, guess what increases? The volume of contents in your blood. You have to have a lot more blood to house a baby. So when you are pregnant, your body needs to make a lot more blood. With a lot more blood comes a lot more blood flow through the tissues, including the nose, and that can lead to the appearance of a swollen nose. The other thing that happens in pregnancy is your mucous membranes in your nose become a lot more congested and swollen because you have a lot more fluid throughout your body, and all of that excess fluid through the mucous membranes can make the nose appear swollen. But the nose goes back to how it looked before you were pregnant. Once you deliver, you're no longer pregnant. So that is not a permanent change. The last thing I want to address about this video, I saw in the comments a lot of people saying, well, you took Accutane and we all know that basically shrinks your nose and gives you a glorified nose job. Is that true? Not exactly. There are a lot of TikToks actually of people showing their nose before and after Accutane and claiming that it basically gave them a nose job, it shrunk their nose. Is that possible? Not really. What can happen with Accutane, isotretinoin is the name of the drug. Isotretinoin, it's a treatment for acne. This girl has been very open and honest about her acne struggles. Does isotretinoin, Accutane change your nose? Well, what it can do and how it works for acne is it shrinks the sebaceous oil gland. Remember, nose is some of the most sebaceous, dense territory on your head. That and your scalp, that's SIBO city. And isotretinoin can shrink the sebaceous glands, so it can make the overlying skin appear less bulbous. And overall, that may have a subtle impact on how the nose appears, but it's not going to change the cartilage or the bone in your nose. Yes, there are some bony skeletal side effects that can happen when taking isotretinoin. Joint pain, muscle ache, backache. Those things happen in people on isotretinoin, but it doesn't impact your nose. It doesn't impact the cartilage in your nose or the bones of your nose. All that to say, if your doctor has talked to you about isotretinoin for your acne, I would not worry that it's drastically going to change the appearance of your nose. The other thing to keep in mind in a lot of these TikToks where people show their nose before and after isotretinoin is often prescribed for people in their teens, late teens, early 20s with acne. Of course, it's prescribed to adults with acne, but that's a huge chunk of the demographic that is prescribed this. But a lot of the people who are posting their isotretinoin before and after nose, keep in mind their before nose was also a nose that was still growing and still changing, so it's not unusual for it to look a little different. Whether or not they took isotretinoin or not, they likely would still see that difference in their nose. As a side note, a while ago I did a video all about this myth around the Accutane nose job, so check that out. But yeah, it doesn't actually change your nose. The other thing though that can happen on isotretinoin, that it dries out the mucous membranes, so the inside of your nose can get dry, making you at risk for nosebleeds. But once you stop the isotretinoin, the mucous membranes, their hydration level comes back to normal and you don't have that issue anymore. And it really should not lead to any sort of sustained change in the appearance of your nose. All right, guys, I hope this video was fun and informative, talking about how different conditions and life stages, life events can change the appearance of your nose. I hope this was fun and informative to you. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.